earliest gestation that you can have a membrane sweep or stretch and sweep from? Hi, I'm Angie. I've been a practicing midwife for the last 13 years and hit the follow button for more pregnancy, birth and parenting information. So membrane sweeps come with risks and benefits, and I've got another video on my page all about the risks and benefits of one. The NICE guidelines recommend having stretch and sweeps anywhere from 39 weeks onwards. Now that has come down because it used to be between 40 to 41 weeks, which is where most of the research actually focuses on, is stretch and sweeps and their effectiveness after 40 to 41 weeks. However, there are some women and people who may be having an earlier induction than 39 weeks, for example. For example, you may be induced earlier because you've got growth restrictions with your baby. Maybe your baby's not growing as adequately as they should be. Maybe you've got gestational diabetes and you are medicated using insulin and metformin, where your induction may be recommended between 38 to 39 weeks, for example. It may be that you've got high blood pressure, again, potentially needing an earlier induction or being recommended to have an earlier induction of labour. And for all of these people, it may be a decision between yourself and the doctor as to whether they would recommend trying a stretch and sweep before going into the formal methods of induction of labour. Now, it is important to note that whilst these are not captured as an induction of labour method, it is still an intervention in itself with the aim and intention of bringing on labour. So a stretch and sweep or a membrane sweep, for example, is still a method of trying to stimulate and induce that labour. It's just that formally these are not captured nationally as a method of inducing labour because it's not including the devices to open up the cervix or alternatively the medications to soften and efface the cervix. So if you know you are having an earlier birth, if you know and you are accepting an induction earlier than 39 weeks, have a conversation with your consultant obstetric doctor and ask them, is it possible to have a membrane sweep earlier than this? And if so, they need to document it clearly, particularly if this membrane sweep is going to happen in the community by your community midwife and not by the doctor before you leave that appointment, for example. Ask them. More than one stretch and sweep has not been found to be as effective as just having one stretch and sweep in your pregnancy. And the more overdue or the more pregnant you become, the more effective and more likely that membrane sweep is to actually work and stimulate labour, which always begs the question, was it the membrane sweep that triggered the labour, or was the labour always going to happen and that membrane sweep might have just tipped enough of the prostaglandin release, for example, to actually get you into labour and birth?